Hi guys, this is Dr. Pangelinen, and in this lecture I'm going to talk about cerebral palsy, or CP. At the end of this lecture, students will understand the types and characteristics of CP. You'll learn about the early signs as well as the causes and risk factors for different types of CP, and you'll become knowledgeable about the supports used to teach motor skills to those with CP. The Centers for Disease Control, or the CDC, defines cerebral palsy as a group of disorders that affects a person's ability to move and maintain balance and posture. CP is caused by abnormal brain development or damage to the developing brain that affects the ability to control muscles. As you'll see in the videos posted about CP, there is a really large range of characteristics which depend on the type of CP and the impact on different body parts. CP is the most common motor disability that affects children. 1 in 345 children in the US has CP. I have posted 2 videos that provide additional information about CP and shows how diverse the children are that are affected by CP. The second video provides a lot of information about how specific types of brain damage are associated with the different types of CP, which we'll talk about in the next few slides. You will need to watch these videos for the quiz. CP may be diagnosed by a pediatrician, neurologist, or physical or occupational therapist. We will discuss 4 types of CP. The first type of CP is spastic CP, which affects about 80% of people with CP. Spastic CP is characterized by stiff or spastic muscles. Think about when you have a muscle spasm. Your muscles contract and you can't stop it from contracting. There are 3 different types of spastic CP which affect different body parts. Diplegia or diparesis mainly affects the legs. It is caused by damage to the parts of the brain near the fluid-filled spaces. It is more common in children born prematurely. People with diplegia may need to use a walker or wheelchair because of their difficulty walking. Hemiplegia affects one side of the body. It is caused by damage to one side of the brain. For example, the right arm and right leg may exhibit spasticity because the left side of the brain has been affected. This might affect a person's ability to walk. Quadriplegia or quadriparesis is the most severe type of spastic CP and involves all 4 limbs, the trunk, and sometimes also the face. Quadriplegia is caused by damage to both sides of the brain. People with quadriplegia may also have intellectual or learning disabilities as well as seizures. Dyskinetic CP is characterized by difficulty controlling the hands, arms, feet, legs, face, or tongue. It is caused by damage to the part of the brain called the basal ganglia. This part of the brain is also affected in Parkinson's disease. People with dyskinetic CP may have slow, writhing, rapid, or jerky movements. The degree of spasticity and control may fluctuate a lot throughout the day. Ataxic CP is characterized by difficulty with balance and coordination. It is caused by damage to the cerebellum. People with ataxic CP may have difficulties with fast movements and those that require a lot of control. Lastly, mixed CP is a combination of the other 3 types of CP. The most common type of mixed CP is spastic dyskinetic CP. This type of CP is due to damage to different parts of the brain, including parts of the cerebral cortex and basal ganglia. Infants with CP may be identified because they are delayed in their ability to do different major motor skills, such as sitting independently, crawling, standing, and walking. There are different early signs based on the typical time frame for acquiring these motor skills. For example, for infants younger than 6 months, early signs of CP include difficulty controlling their head, muscles that feel stiff or floppy, and legs that cross or scissor when the infant is picked up. For infants that are between 6 to 10 months, early signs of CP include difficulty rolling over, not being able to bring the hands together, difficulty bringing the hands to the mouth, and having one or both hands in a fisted posture. For infants that are over 10 months, early signs of CP include difficulty crawling, such that the infant might drag one side or one limb, or the infant choosing to scoot instead of crawling. Scooting is a much more stable posture, especially if the arms are affected by CP. As mentioned, CP is caused by abnormal development or damage to the brain. A lack of oxygen to the brain before birth, during the first month after birth, or even during the first year of life can cause brain damage. Congenital CP is caused by abnormal development of the brain or damage that occurs before or during birth. This type of CP affects 85 to 95% of those with CP. Risk factors for congenital CP include low birth weight, premature birth, multiple births like twins, the use of assisted reproductive technologies for infertility like IVF, infections during pregnancy, jaundice, and maternal conditions like thyroid problems, seizures, or intellectual disability, as well as birth complications, including problems with the placenta or the umbilical cord. In comparison to congenital CP, acquired CP is caused by abnormal brain development or damage more than 28 days after birth. Risk factors for acquired CP include traumatic brain injuries like those from falls, car accidents, or child abuse, and infections. Therapies typically include physical, occupational, and speech-language therapy, which can help to improve independent performance of daily activities, including walking, dressing, eating, and communicating. Because individuals with CP may also have other difficulties that include vision problems, intellectual or learning disabilities, and seizures, they may also work with other clinicians, including developmental ophthalmologists, special education teachers, and neurologists. This link is posted as an optional video. But for those of you that are not familiar with Zach Anner, he's a writer and comedian who has CP. He has a YouTube channel that discusses how he navigates many common activities, but in a very ridiculous and funny way. I encourage you guys to watch this video and to check out his other videos. When we have children or adults with CP in our adapted exercise and sport programs, we use several different behavioral supports that we've talked about in the previous lectures. Given the balance, mobility, and coordination difficulties commonly experienced by our participants with CP, we tend to use more physical supports. This includes holding on to the participants' hands when they practice balance, like the picture on the left. We can also use bars, walkers, and other physical supports to help ensure our participants are safe while learning new skills. We also use many task modifications to adjust the amount of time, coordination, or balance demands, as well as instructions to complete a task. The picture on the right shows a participant with spastic diplegia, which affects both legs. He is using a walker to walk around hurdles. Eventually, when he has enough strength and balance, he would step over the hurdles while using the walker. For participants with CP that also have intellectual or learning disabilities, we incorporate visual supports and verbal supports. These supports help reduce the memory demands, enable transition between activities, and help us focus on one or more components to improve at a given time. Okay, please pay attention to the Canvas announcements regarding the required videos to watch for the quiz. I have highlighted 2 videos on slide 4 of this lecture that you need to watch. Please contact me if you have any questions about the content, and good luck.